Hello, so it's day 3 after, or 2 days or 3 days after it seems as if I've sprained some of the ligaments in between my sacrum and my SI, so right in that something within the sacroiliac joint. The pain area is like about an inch long, it feels and it's kind of morphed. Like this morning, it felt super vulnerable and very uncomfortable. Like there was almost like a raw injury. As the day progressed, the pain kind of went away, and until I've sat for the last few hours, and it came right back. And now it kind of has it it's moved up, and I think I hypothesize that the way my body reacts to it is that for some reason it tightens up the quadratus lumbarum QL muscle that's kind of runs down on this side. So I feel in the QL muscle right now this this kind of about an inch or two above the SI joint. It feels it almost feels like the pain's coming from there. So basically I figured out what I did earlier is I just stretched out my hamstrings and my quads and basically all of the ligaments that attach to your pelvis. So I do kind of this, and I noticed earlier that the pain went away, and so maybe that's what I have to do to get rid of the pain. So I'm just gonna show you what I do. I've kind of did this in my last video, but an interesting thing is that I've had about 6 months of no pain in the back after about 3 or 4 years of chronic pain. And so immediately I started I went to work last week and did some physical heavy lifting, and it just, ever since then, it's just like everything I do seems to injure it, especially stretching it. So these won't stretch the muscle, but this will stretch like everything around it. But I found that it just feels really good. Show you what I'm doing, and I'll just see if this will do anything for me right now. Interestingly, this side actually feels amazing. Like it feels tighter, like really tight on this side, which isn't really the side with the pain, but and it doesn't. I have this popping in my the top of my femoral head, and it doesn't just pop there. It kind of pops in a lot of places, and sometimes it'll pop when I'm sitting down, like when my leg's like this and I'm sitting in a chair and I can move it like this, it'll pop down in there. Which that symptom went away, actually, for the last few months. I haven't really had much popping. But immediately as I've injured that, it has come right back. Hamstrings, see right there, it popped. Hamstrings are feeling really good to stretch. It's interesting how it feels when it's painful. It's like it's as if like my focus completely only can be on the pain of it. I can't really do anything else until I take care of it. And it's such a bad place to get an injury because it's so hard to immobilize it. It's partly, I think, why I've had so much problems. I noticed that in the past too, when I had this kind of pain, I let my posture suffer, because that for a short period of time seemed to alleviate the pain. But I think long term that really was a hard part of it to correct. How much time left? 5 minutes. And I think it's generally important to not stretch. I don't know. See, this is interesting. The opposite side feels amazing. Really amazing. Which is really interesting, because as this problem has developed over the years, the type of pain that I feel right now is not exactly what I was feeling 2 years ago or a year and a half ago, when this really kind of flared up and was at one of its worst points, and I was like in bed all day. It was just so painful, I couldn't sit down. So yeah, this is really interesting that this stretch right here really, really tight on the right, this area. So there's another one I wanted to do. Then I go like this. I'm actually not going to do this one too hard, because this is really kind of like the problem area. And I'm going to keep doing these after I shut off this video, but at least you get a sense of what I'm doing. I wanted to show you this too. I do this pretty regularly. It's how I crack my back. I go like, get in this position, and I grab this, and I kind of can get it pretty good. And I mean, so you can see what my back is doing. So I'm going to do the same thing on the other side, so you can kind of see how I do it. So I kind of go like here, grab this. So, yeah, kind of an interesting crack pattern too. Okay, and I've been taking these too. This is Flexerol. That's the muscle relaxer that I use. That's supposedly not addictive, and I hope it's not. They got a bunch of these. Apo-Cyclobenzaprine is what the technical name is, but really it's Flexerol. Hate taking it in the daytimes. I hate taking it at night too. But so yeah, I hypothesize right now that I have something sprained, and some kind of sprain in the SI joint. But thanks for joining, and when I make the next video, hopefully I'll remember. I could tell you if any of the stretching relieved any pain. And I'll be doing studying now, because that's usually when I do my most studying of this, is when it starts hurting. Anyway, see ya.